We're Motion Palpation Club. We're going through the lower cervical and CT, beginning the CT junction. I've got Taylor and Bailey with me. They're going to go through those assessments, and I'll jump in if need be. We do have an ART seminar coming through Edina. It's at a clinic at Dr. McDonald's clinic. She was just able to provide a space, whereas the hotel rejected the idea from ART. So it'll be hosted there from November 5th to the 8th. So be sure to check that out. And if you have any questions, feel free to reach out to me or anyone who posts on the Facebook page. From there, I'm gonna give the camera to the girls, and they're gonna take it away. How's that?
I feel it's good. Okay, so to start off, we're just going to go through the range of motion for the lower cervical CT junction area. So to start off, I'm going to do flexion. So I'm going to have the patient bring their hand forward into flexion, and then just with a pincer grip starting at the bottom, or so like pinching my hands together like this, pincer grip like we've used in methods. I'm going to start at the bottom of that CT junction area, so about T4, and then I'm going to press I to S on that spinous process, trying to induce more flexion. And then to check extension, I'm going to bring the patient's head back and then pressing on the spinous again, but this time S to I, I'm going to try to induce extension, going down from that CT junction area. So then moving into rotation, what I'm going to do is I'm going to contact the top of the patient's head and then hook the front of their shoulder. And then I'm going to rotate the patient's head and their top of the thoracic spine, and then taking my thumb contact, I'm going to contact their transverse process, and then just P to A pressure on the transverse process to try to induce more rotation, and then do that on both sides. So then P to A on that transverse process again on this side. And then to do lateral flexion, you're going to take the same contact, bending their head over, and then the top of their thoracic spine as well. And then here you're going to contact the opposite side spinous process, and then push L to M on the spinous process, trying to induce more lateral flexion, and then do that bilaterally as well.
Gonna get a shot of you from the side here.
Yeah, sure.
And then do rotation one more time. Yeah. And then rotation. So she's pushing on the TP. You can also use a spinous contact for this one too. Sweet.
Okay, so then we can go into the first CT setup. So what I'll have to do is I'll do the prone one first. So I'll have the patient laying face down. And for this one, you can do more of like an assisted technique where the patient lays their face facing away and you stand on the ipsilateral side of the contact. And then here I'm going to take like an MCP, thumb contact as well, thumb facing towards the spinous that you're adjusting, and then the MCP contacting more so, I guess, resting on that trap. And for this, you're going to take your indifferent hand and you're going to traction up. I'm in a modified fencer stance here, bringing my work close to me. I'm going to traction up on her occiput, and then my thrust here is going to be L to M with S to I as well. So do you want me to do it on the other side too? Or?
Yeah, sure.
Okay.
Let's do the other side.
And then on the other side, we'll just do that over again. So I'm going to have my modified Spencer stance. I'm going to take my MCP, my thumb contact facing towards the spinous that I'd be targeting, traction up on that head or on the occiput, and then thrust the L to M, S to I for that as well.
Sweet.
And we can go into the seated one that was covered in the video. So patient's going to be seated about xiphoid height, so maybe just a little hair lower for me here. For me, or people with small hands, sometimes on the lower CT junction, I won't be able to contact necessarily the spinal laminar junction or just the area of this vertebra that I'm targeting. So what I'm going to do is when I contact towards that spinous, come forward a little bit, I'm just going to aim my fingers towards the vertebra that I'm targeting. So what I'm going to do is I'm going to bring her head back, so it's resting on my stomach, traction up, bring her head over into my hand, taking that side step out, laterally flexing over, and then here I'm going to thrust L to M along the line of the shoulders.
Sweet.
And just focus on making sure when you're laterally flexing over that you're also tractioning up on the head.
Want to set it up on the other side?
Oh yeah. So I can do it on the other side as well, taking my contact and then laterally flexing the head over, bringing the chin back, tractioning up, and then your thrust is going to be across the line of the shoulders.
Mind if I say something quick?
Yes, go for it.
Okay, so just to add to that a little bit, and you could see Taylor was doing this the whole time. She's putting her body in a really good position for her adjustment. So you want to stay really close to your patient. So she's even resting their head down against her abdomen. She's laterally flexing, distracting with this indifferent hand, taking her step over, and then she's leaning, or some people bend at the knee, which she was doing. Some people hinge at the hips. Some people do both. I just hinge at the hips. But I get my face close to their face. When you're adjusting, you want to be close to your work, or it's going to rob you of your speed and power. So here you want to come in, and I'm like, my nose is like this far from her shoulder. So you want to stay close to your contacts with these adjustments.
Okay, so now we're gonna move into first rib. So for the assessment of first rib, you're just gonna find that spot right in between the scalenes to feel the further rib. And then we're going to rotate her head this way, away from the segment, and then laterally flex and extend back and feel that rib pop up on your fingertip. And then to feel if it's moving properly, we're going to laterally flex over your contact, and that rib should dip down. If it doesn't dip down, then it's fixed. And then for the adjustment for that, well, I guess you can do it on the other side too. So if we're gonna feel on this left side, we're gonna rotate away, extend or laterally flex away, and then extend back and feel the rib pop up at you, and then laterally flex over, and it should dip down. So for the adjustment for this, we're gonna have the patient rest their arm on your leg here. And then we're gonna be adjusting the opposite rib that their arm is up. So I'm adjusting this left rib. So we're going to place our MCP contact onto that rib, that first rib that's fixed. And then we're going to lean forward and away, and then laterally flex their head over the contact, and then thrust L to M, S to I. And then same thing on this side. We're adjusting this right rib, rest the arm up on your leg, get your MCP contact on that rib, and then laterally flex their head over while you lean forward like into a lunge, and then thrust L to M.
Sweet. One thing I just want to add to that. So just to be clear, we're not Bailey mentioned that we were adjusting, so we're just setting up here. Just want to make that very clear. With our adjustment set up, we're contacting in here in the rib. She did a good job explaining that. We want to make sure that we're distracting with this in different hand. So um, when you contact the trap, you can either tissue drag up or down. It's kind of just like Corey Campbell mentioned in the video, it's just to get yourself an established position on the patient's body. So I like to drag back, distract with this hand, and then take your lunge, and you'll feel the restriction. Like it's very evident under your hand. And with that thrust, you want to keep this elbow at a higher position versus kind of lower, just so you can obtain that S to I motion, because that's where your fixation is going to be. Your first rib is going to be fixed superior for the most part. Okay, so for supine, very similar to the assessment. So this is also going to involve some extension, and like I mentioned before, we're not adjusting the cervical spine, so some extension is required to get these adjustments to go in most cases. So I like to laterally flex right away in any adjustment in the supine position. It just makes it more comfortable for the patient. From here, I'm going to drag with my MCP so the back side of the trap, so her posterior side of the trap, I'm dragging towards me anteriorly. I'm going to rotate and then extend her neck slightly. From here, I'm going to get my body in a really good position, really close to the adjustment. And then it's a thrust, basically S to I, kind of going across. There's a bit of L to M in that, but I'm thrusting like kind of where her elbow's sitting with my thrust. If you're not fast with this adjustment, it just won't go. You have to have the speed. That's why I put my body in a really good position to administer the adjustment. So from here, I'll set up on the other side. So laterally flex, set them on the headpiece. Just what I do, I preferably do. Trap, pulling it P to A. We're going to rotate and extend the neck. And then from here, it's just straight S to I, kind of towards the elbow.